Hello, everyone. It's Monday, March the 29th. We've had 10 deaths over the weekend that I have reported now. That makes our total deaths 2,638 deaths in West Virginia. It's hard to celebrate. We've only got 10 deaths, but to be perfectly honest, from where we've been and, as we continue to trend this way, that's good. And I'm just scanning through it real quick, but the youngest person that we have in these 10 deaths is a 63-year-old male from Marion County. I urge you beyond belief, if you're 65 years of age and older or they're close, and you get the absolute first signs of any kind of situation that may lead you to be anxious, headache, cough, temperature, just feeling a little bit tired, whatever it may be, please go get a test. And if we can catch this early, you can get the antibodies and really and truly probably not really have a problem whatsoever. If we don't catch it early, you got a big problem in line for you. I would tell everyone just this. Again, we've got 10 deaths. The youngest person is 63 years of age. What do we have to do? We've got to go get vaccinated. All those, especially those 65 and older, you've got to go get vaccinated. That's all there is to it. Now, a tremendous amount has stepped up, well in excess of 70%, but it needs to be well in excess of 85%. We've got to get you vaccinated. Now's the toughest part on the mountain. The steepest part is always near the top. We've got to go get vaccinated. Now, that's just all there is to it. Our 2,629th death is an 82-year-old male from Monongalia County. Our 2,630th death is a 78-year-old male from Berkeley County. Our 2,631st death is a 63-year-old male from Marion County. Our 2,632nd death is a 75-year-old male from Kanawha County. Our 2,633rd death is a 74-year-old female from Putnam County. Our 2,634th death is a 71-year-old female from Logan County. Our 2,635th death is a 75-year-old male from Kanawha County. Our 2,636th death is a 67-year-old male from Raleigh County. Our 2,637th death, an 89-year-old female from Kanawha County. And our 2,638th death, a 93-year-old female from Kanawha County. This disease attacks the elderly. Some diseases attack our children. This can attack all of us. But the number one target is our elderly. Please take heed to that. Please, West Virginia. If you know your granddad or your mom or dad and they're 60 or 65 years of age or older and they, for whatever reason, have been real stubborn about getting vaccinated, please, they have so much more life, so much more life. Please encourage them every way and help me to get them vaccinated. Today is the anniversary. It's not much of an anniversary, in my opinion, but it is the anniversary of the first COVID-19 death in West Virginia. Since that time, we have lost an additional 2,637, making it 2,638 deaths. I think we should absolutely all join in prayer. I'll say the beginning of the prayer, and then when I stop, I think we should all have that moment of silence. I'll lead us off with the prayer. So let us pray. Dear Heavenly Father, we're a good state, and we've got great people, and we're a great nation, And this world in every way, especially our nation and our state, need you and need you to help us stop this incredible pandemic that has taken so many. 2,638 great West Virginians are gone, and more probably will go and add on to that. I ask you from the bottom of all of our hearts to some way hold them close to your heart and let their families know you're with them. And in every way, I pray that you'll help us to get through this terrible, terrible pandemic. It's been tough. It's really been tough on so many. So as I pray and I ask for this moment of silence for all those that we've lost and all those that are struggling throughout this great state. So as we pause, please, please fill their hearts with hope and a light that we know you're there. And now we'll pause. Thank y'all. Last 24 hours, we've had a new 378 positive cases. Our daily positivity rate's 5.55. Cumulative rate still comes down a little bit to 5.27. Our active cases, we were right at or below 5,000. Now we're back up to 6,252. Recovered cases are 132,101. We're up well over 200 in people that are hospitalized in this state, 222. Our ICU beds, we were down around 50, and now they're 83. You know, our daily red counties now, we have 2 counties, Berkeley and Raleigh, that are in the red. I'm telling you, this thing's not over. It's so close to being over. Did you ever have a time in your life, and I've said it so many times, when you were right there at the altar, and then it all turned the other way? That's where we are. We need to continue to get everyone vaccinated. The more we get vaccinated, the more the chain is broken, and absolutely we will conquer this disease. If you're 65 years of age and you're feeling the least bit funny and you don't get a test, you're really making a bad mistake. So please, please get tested, where we can give you those antibodies and absolutely break this thing, and it probably wouldn't be very bad on you whatsoever. The vaccine eligibility vaccines are now available to all West Virginians that are over the age of 16. I saw a map this morning on Fox News, and there was just a sprinkle of states that now they showed these states in the red. There was there was 5 or 6 or 7 states in the red. And those states that were in the red, they were signified by saying that they're starting now to open this up to everybody. And then it showed the states that were in gold, and there was 5 or 6 of those that had already made the decision and stepped forward and said they're opening it up to everybody. And we were one of the gold. Ohio is now deciding that it's a good idea, and they're going to open it up to everybody now. But absolutely, West Virginia was at the forefront again, and absolutely opened it up to everybody. And so please, go get your vaccination. We're now at 96% of the total administration rate for the first and second doses. Goal is always 100%. We've now got shots in the arms, and it hadn't changed a whole lot, 796,433 doses. All the Saving Our Wisdom clinics are up, and they're going. You know, thank God we made this move. that we've got 235,025 people that are of the age of 65 and older that have gotten their first dose. We're over 72% of our 65 and older population, and this is with, in counting, the Veterans Administration and the Federal Pharmacy partnership with Walgreens, and I want to touch on that in just a second. I want us to hit 85% on this. In fact, I want us to even go higher than that. But, if you're 65 or older and you're still waiting on a vaccine, call the West Virginia COVID hotline, COVID-19 vaccine info line. Call that number. If you're 65 years of age and older and you haven't gotten your shot and you're waiting, call that number. Call that number. Please call that number. The vaccine scheduling system for West Virginians age 16 and above can pre-register. Takes about 10 minutes to do so. And absolutely, we're going to continue to prioritize those that are 65 and older. There's an announcement that Walmart has now joined the Federal Pharmacy Partnership expansion. And so West Virginians can go to vaccinefinder.org to assist in helping to locate and secure an appointment at one of these federal pharmacy partners. Walmart has joined Walgreens and the Med Shop Leader Network of pharmacies, and it all ought to be up there online and everything. So go there and get the additional information, and please go get vaccinated. In our long-term care facilities, we've continued to do good work there, and we're starting to be able to vaccinate folks, there as well. And, starting this week, long-term care facilities across the state will begin offering COVID-19 vaccines to family members and caregivers of the residents and staff as part of the vaccine plan for the long-term care facilities. And now West Virginia will again be among the first in the nation to expand our vaccine maintenance plan to include family members of residents and staff. That's a big, big step forward and everything. So we're going to take care of not only the residents and staff, but we're going to take care of the family members as well. And we're going to be recruiting people to get out there and get your vaccine. On our manufacturing outreach, our joint interagency task force continues to reach out to manufacturers and businesses across the state to increase access to employees and their families choosing to be vaccinated. Now get this. On Friday and Saturday, we were the first in the world to offer COVID vaccines on site at a Toyota plant. Now get that. That's pretty neat. Our partnerships between Community Health Centers Pharmacy and National Guard were able to vaccinate employees and family members at the Toyota plant in Buffalo, West Virginia. And over 900 were vaccinated. We continue to expand the outreach to our manufacturers and other businesses to help vaccinate more individuals. It's great stuff. Way to go, everybody. The COVID vaccine info line is up there as it's been forever. The vaccine reminder, please don't listen to the garbage people pass around about the vaccines that scare people. It is absolutely, you know what it is? I said it a bunch of times. But what it is somebody that absolutely, there's an old saying, misery loves company, or company loves misery. If you'll just think about it, why is it that if somebody has chosen not to take the vaccine, that they're out recruiting you to not take it? Why are they doing that? Why in the world are they doing it? If they decide not to take it, why don't they just keep their mouth shut? Why are they out trying to recruit you and saying, oh, if you take this, your arm's going to fall off, you're going to grow antlers, or whatever it may be? Why are they doing that? Because Misery loves company, and company loves misery. So you absolutely just take that to heart, please. Our free testing's up, the map's up. You can get tested for nothing and everything. We encourage you to continue to take advantage of this. We appreciate Walgreens, we appreciate Frith, and we appreciate all those that have stepped up with our drive-through testing and all the good stuff that they've done. We have 4 outbreaks in our long-term care facilities, 7 outbreaks in our churches. I keep warning our church community about this and everything. You know, these outbreaks account for a total of 101 cases, and they are in Kanawha, Fayette, Monongahela, Raleigh, and Nicholas counties. They're in 5 counties, and I keep warning us, keep that pew in between you, wear your mask. Let's just don't drop our guard here. You know, we're close, but this thing can bite us, and it's a crying, pitiful shame. You know, when you're in church, you just look around. Take a second to look around. You know, if this thing whiplashes on your church, a place that you absolutely guard so close to your heart, look around. It's all you've got to do. Just look around and just think, what if this breaks bad on your church? And you look closely at the people there, and you just think, we could lose that person, or we could lose this person. We could lose you. Absolutely, you've got to get across the top of this mountain. And it's steep right now. It's tough. Corrections, what a job. 4 inmates have COVID right now. 9 staff members. It's incredible work. Great job. You know, the guidelines for everything are up there. I encourage you still to wear your face covering, and I encourage you over and over and over to give blood. Give blood. You know, we'll be announcing, doing another one of the town halls on the personal income tax. All I would say to you, West Virginians, is just this. You know, you have listened to me so faithfully. I would tell you without any question, you do not understand what is at stake with the personal income tax. You think and have been convinced that it is going to materially affect you in a negative way. And I am telling you without any question, you just don't understand. Absolutely. It will materially affect you, it surely will, but it will only materially affect you in a really positive way. I'd say to every West Virginian out there, take the time. This is so important, it is off the chart. Take the time to understand the facts. If I'm wrong, tell me. If I'm wrong, challenge me. Take the time to understand the facts, because you're going to absolutely leave so much money on the table, and it's going to hurt you. It's going to hurt you. You've got lawmakers that don't understand. You've got people that don't understand, businesses that don't understand. They just don't understand because, it's complicated, it's change, and absolutely then everybody just kind of just decides, well, I got this, and and whatever the situation may be. It is the single most important thing to the state of West Virginia that has ever been put before you. It is the single most important thing to you as individuals. Without any question, you are going to throw away monies like you can't imagine. Personal money to each and every one of you. You're going to throw away business opportunity. You're going to throw away absolutely our opportunity to grow in West Virginia and prosper. It is the single biggest and boldest and most important thing that you could ever deal with, other than life and death with all this other stuff. You may say, well, why not put it off? Why not just put it off? And if you put it off, while the spotlight of the world is on us right now, the spotlight will leave. And then it will be a very difficult uphill battle. Absolutely, all I ask is that you trust me enough to try to understand it, that put in enough time that you really get the facts. The facts are just as simple as just this. On the left hand, every single person, no matter what the wage level is, under 10,000, over 100,000, every single person in this state will end up with more money in your pocket after you pay all the tax stuff. After that, you end up more money in your pocket than you have today. Now, that's the left hand. The right hand, I've said it a million times. The right hand talks about all the opportunity that this state will have, that you'll have. You know, from people moving here, it'll help our schools, our roads, everything under the sun. And I think it will be an avalanche of people. If you don't think it's going to be many and everything, that's okay. That's okay. Now I ask you just to do this. Throw away the left hand and the right hand. Throw those away or set those aside. They're absolutely truthful as truthful can be. But just imagine just one thing, and just this. If every single household in this state had an average, and I've said it 1,000 million times, an average of $1,483 extra dollars, that's what you're looking at. And what will happen with that $1,483? If it's true to you, like it would be to me, people spend their money. And when they spend their money, just like is happening right now with the stimulus checks that come in, go to a store, go to Walmart or wherever, and you may say, well, gosh, the shelves are almost bare. What is going on? That's the stimulus dollars. With this, these dollars will come every single year. They will come in the form of checks to you, either monthly or every quarter. They will absolutely come every single year from now on. And they will only grow in size as we get rid of more and more and more of the income tax. What's that going to do to the local dress shop? What's it going to do to the local gun shop? What's it going to do to the local, the local fishing spot? What's it going to do to our state parks? What's it going to do to the people that are buying advertising? They're going to buy more. They're going to buy so much more, it's unbelievable. You know why? Because when you total up all those households, you come to $1,087,000,000 that's going back in your hands. It is exactly the foundation of the Republican Party. Exactly that. It is growth and putting money back to the people. That is exactly what this thing is all about. Now, I would encourage you in every way to call your representatives on both sides, the House and the Senate, because we're about to miss the biggest opportunity that we have ever had, 1 trillion to 1. And if we miss it, shame on us. All I can do is tell you. But again, we'll have another town hall, and we'll have maybe even 2 more of them this week, and then we'll just start amping that up even more. But I think we'll do it. We'll probably do it on the way it looks right now. We'll probably have to do it on Wednesday. But we'll let you know. We'll let you know later today. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. As the governor said, this is a particularly important time for West Virginia and for our country. We are seeing, as we talked about on the press brief on Friday, an increasing number of mutant variant coronaviruses that are affecting Americans in states like Florida, in states like Michigan. And we talked a bit about Michigan having a 633% increase in 30 to 39-year-olds being hospitalized since March 1st, and an 800% increase in hospitalizations of 40 to 49-year-olds, and the fact that they're seeing fewer and fewer over 80-year-olds in the hospitals because of the vaccination strategy. And that really tells us how effective these vaccines are. We also know that variant viruses like the United Kingdom virus is really capable of infecting younger people and making younger people sicker, about 50% more infectious, the United Kingdom variant, and about 50% more lethal, kills more people at a relative proportion, a relative comparison to the native COVID-19 virus that was defined in Wuhan, China. And I don't say that to scare people, but I do say that because I think it is so important for us to be highly vigilant right now as we are trying to immunize more people. When we look at Europe, we know that two countries that have not vaccinated nearly as successfully, Germany and Italy, are starting to see surges on their healthcare system. And two countries that have vaccinated much more aggressively, Israel and the United Kingdom, are not. And so as we look at West Virginia, one of the benefits we've talked about is the fact that things come to us a little bit later than they come to states like Florida and New York and California and Texas, really large states with big urban centers. And what we have that ability to see now is the fact that these mutant variants, the United Kingdom variant, is starting to spread. And we've only seen a handful of cases in West Virginia. The last count that I'm aware of was 24. But we also know that this virus is now spreading in younger people. People between 16 and 30 are the group that we really want to focus on our vaccination efforts. So we really approach this in two ways. We approach it still in a very disciplined, committed way to make sure that we are immunizing all of our elders. As the governor said, we want to be over 85% in our over 65-year-old group, and we'd love to be over 80% in our over 50-year-old group. Remember, 97% of people that have died in West Virginia have been over 50 years old, and we have already created a maintenance program for our residents and staff of our nursing homes and long-term care facilities and assisted living facilities, which is a group that had high death rates at the beginning of the pandemic. But what's really important for us right now, and particularly for those of you West Virginians that have children or grandchildren that are going to school or are in their 20s, that we want you to help them realize, and we hope that they hear us too, that right now is also a really important time for them to pay a lot of attention to wearing their mask and staying physically distanced and being careful. And we want to open up more and more vaccines to this age group because we know that this is the group that is spreading COVID quickly. And we know that for the variants to take hold and to continue to mutate, they have to be infecting somebody. So we really are focusing now on that second front, not only our elders and save our wisdom, as the governor has said, and certainly looking at people with pre-existing medical conditions and other vulnerabilities that gives them higher risk of dying or being hospitalized. But now we're also, because of sufficient vaccines, able to turn and make sure we try to reduce that spread so that we can buy ourselves more time, get more people immunized in these age groups that are now starting to get sick with COVID-19, but also protect our young, because we don't want people to end up dying of COVID-19 at much younger ages. And we also want to prevent long-term side effects, the so-called long COVID, which can impact people for months and months after COVID. So this is a really important time that we are adding to our strategy, And we're trying very much to target this younger group of people to protect them, but also to make sure that we slow that spread of the virus, and particularly the variant virus in West Virginia. So we hope not only as you're older or have pre-existing medical conditions that you will choose to take the vaccine, but also we very much hope that the younger people will also choose to take the vaccine with their parents and with their families so that we can protect them, but also buy us more time so that we can continue to immunize more of West Virginia and get to be like the United Kingdom, which has immunized about 50% of their population with at least one vaccine, and Israel, which has vaccinated 2/3 of their population with at least one vaccine. So thank you very much.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good morning. I'd like to highlight a couple of the strategic initiatives that Governor Justice and Dr. Marsh have highlighted. We now have the resources to open up onto two fronts, and we are going to continue to stay focused on the over 65 population. And as the governor has challenged us, we're going to go beyond 75%. We're going to go to 85% and beyond. The same will hold true with our over 50 population as we continue to get into our essential workforce with the addition of additional clinics like the Toyota clinic. Again, highlighting that is the first Toyota plant, not in the United States, but the first Toyota plant in the world to host a vaccine event, not just for its workers, but for family members. But in addition to that, we will also continue to now work on highlighting areas in high schools with events, as well as in our colleges, to get to that population, to bust that infection rate. So we have a lot of work to do going forward, but we are prepared to do that. We had another good week. Over 102.3% of first doses were administered from the central amount of vaccines that we received at the state level. The other area I'd like to highlight is we want to challenge our churches. If you are a church pastor and you have a congregation that hasn't had the opportunity to get vaccinated, but wants to be vaccinated and want to bring family members with young teenagers 16 and above, contact our Joint Interagency Task Force and we will work with you to vaccinate your congregation. We know that sometimes people are more comfortable working through their church congregations. So we ask you to challenge us to help you get to that point, and we will work with the counties and the other entities to get you taken care of. Last thing I would like to leave us all with, today is Vietnam War Veterans Day. And I hope that we all take the opportunity to stop and thank our Vietnam veterans. You know, we in this country refer to our World War II generation as the greatest generation. And I refer to the Vietnam veteran generation as our most determined generation, because when our country did not effectively treat them the way they should have been treated when they returned home from war, because of the challenges that we had in this country towards the war, they did not give up on their country. They have been at every event that I've seen since the start of Iraq and Afghanistan campaigns over the last 20 years. Every event, send off and return home for our West Virginia National Guardsmen, they've been there because they didn't want those men and women to be treated the way that their country treated them when they returned home from war. So I thank all of our Vietnam veterans for their service, sacrifice, and their dedication to our country. Thank you.
All right, thank you, sir. Next to Dr. Ayn Amjad, our State Health Officer.
Good morning. We've seen a nationwide decrease in testing of COVID-19, and that's very concerning, especially as Clay mentioned about variants across the state. So we do want to remind everyone that testing is still available across West Virginia, and it is free. So we do encourage anyone, if they have any symptoms, as the governor mentioned, even if it's a sniffle or any type of sign, we do have testing available. As you've seen, we do have 2 red counties in the state. So we encourage people, especially in those counties, or if you have any high risk behaviors, or if you're around anyone that has COVID-like symptoms, to go ahead and get testing. Also, if you're around any crowded areas, to continue to wear your mask. If you've been fully vaccinated, then that does offer some protection. So we have opened it up to 16 and to anyone 16 and over is eligible for the vaccine. So when you're able to get vaccinated, we encourage everyone to get vaccinated as well. Thank you.
Thank you, Doctor. And finally, to Secretary Bill Grouch with the DHHR.
Good morning, everyone. In February, the United States Department of Agriculture approved issuance of a second round of funding for the Pandemic Electronic Benefit Transfer Program, or PEBT, for children who would have received free or reduced price meals under the National School Lunch Program if their schools were not closed or operating at reduced attendance hours due to COVID-19. In February, Governor Justice announced West Virginia will receive $200 million as a part of the second round funding. The program is administered through the West Virginia Department of Education and DHHR and will benefit approximately 221,000 students in West Virginia. Letters notifying parents will be sent out in the next few days, and benefit cards will be sent out by the end of April. The benefits will be issued to a special PEBT card, not to the Mountain State EBT card. Thus, families will receive a new electronic benefits card in the mail. We know the pandemic has been an incredibly stressful time for West Virginia families, and we hope that the PEBT alleviates some of those challenges. Thank you.
Thank you, Secretary. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thank you for taking the question. On a personal note, since other people have mentioned it, I got my second shot yesterday. The Walgreens system worked very well. Thank you to General Hoyer, specifically for your efforts in getting the vaccination system up and running. I appreciate it personally, and thank you for the work you've done for the state. As far as the question, I want to circle back to something that was mentioned a while back and has been kind of an undercurrent for a lot of the briefings to Dr. Amjad or perhaps to Secretary Crouch. I'm going to get into it more specifically with other members of DHHR, but from your standpoint, guys, and Governor, you can chime in as well. When you have the pandemic that's on top of the epidemic of opioid abuse and the opioid problem we have, and we've seen deaths increase and other problems, where do you rank how we're dealing with the opioid epidemic in the middle of this right now? And what are your hopes as we move forward to get out from under the pandemic that we can do to help start beating back the bad effects of the problems that we've had with opioid here in West Virginia? Thank you.
Well, Bill and Dr. Amjad, you guys are surely welcome to jump in here, but let me just say this, Kenny, I've said it over and over, but prior to the pandemic, my voice would have been, at some point in time, even though we all know this, that our drug epidemic, that none of us are, kept completely safe in any way. It affects us all. I mean, Democrat, Republican, black, white, rich, poor, doesn't matter. Doesn't matter, does it? All of us, it affects us all. And so I've said it over and over, really and truly, we've made some real strides. We've made strides in, Jim's Dream or Jobs and Hope. We've made real strides from the standpoint of, things that we're doing like communities in schools that's just a home run, and we've sponsored bills that, created, recovery and hope and all that. And we've done all kinds of different things. But at the end of the day, we've all got to realize that this drug situation can cannibalize us if we don't watch out. And I have said that over and over. Right now, front and center is this pandemic that's taken 2,638 deaths. The pandemic will leave at some point in time. And we'll have to absolutely, even though we haven't taken our eye off the ball, we'll have to do more refocusing. We've just sponsored a situation to where we've created an office of recovery and hope, and where we're going to have people without growing government in any way. we're going to have people that are going to absolutely just dial in. So Kenny, I get it. I get it wholeheartedly. You know, we've been surely distracted and running to the fire on the COVID stuff, but at the same time, we've got a lot of things going on right now, and we're sponsoring a bill that's going to create an Office of Recovery and Hope, which is just an offspring of Jim's dream. So guys, if y'all, Bill or Ian, if y'all want to jump in, please jump in.
Yeah, thank you, Governor. That was right on target in terms of the issues. And Kenny, good question. The effects of this pandemic will be felt for years and years and years. And the effects of this pandemic are going to be felt even more so on those with SUD, on individuals with mental health issues, where isolation and lack of support throughout the country, not just West Virginia, leads to more problems. So we've talked about this several times in terms of trying to deal with the epidemic within the pandemic. Let me just say that Dr. Matt Christensen, our director of the Office of Drug Control Policy, is just doing a terrific job. Christina Mullins, our commissioner of the Bureau of Behavioral Health, we have folks who have continued to do what needed to be done with regard to the SUV problem in West Virginia. We have pushed very hard, more naloxone throughout the state. We have developed programs that we think are making a difference, but we still need to do more. We have a situation again where people have been isolated for so long that it's very difficult to get the assistance needed sometimes. So great question. We're focused on that and have stayed focused on that, but it's a difficult issue. Thank you. I didn't know if you wanted to add anything.
The only thing I'll add, Kenny, is that we've also, have the Help for West Virginia that we have been showing on our daily press briefings, and we encourage people to utilize those numbers. The pandemic for COVID-19, has pushed people into isolation, as Secretary Crouch has mentioned. So people who suffer from opioid addiction and problems have had to suffer alone because we've had this problem with COVID-19. So we realize the opioid epidemic is an issue in West Virginia, but we continue to push to have better resources for people and want people to reach out for help as needed. But we'll continue to strive to be better and serve the people of West Virginia as we move forward and get over this. Thanks.
All right, thank you, Kenny. Next, we'll go to Mark Cram with WDVM.
Well, good morning to everyone. And again, thanks for your time. I happen to be chatting with a gentleman who grew up in West Virginia. He now lives in another state. I won't reveal that state, but and he lamented. He is 60 years old. He still hasn't received his shot. He wishes he were back home in West Virginia. So they're a good piece of information. I wonder if there's any data or demographic information on the number of cases that have just blossomed, we'll say, with Berkeley County, Raleigh County now being in the red and other counties, adjacent counties being in the orange. Are these individuals who were older individuals who simply didn't get the vaccine? Was it younger individuals who haven't up to this point been available or eligible for the vaccine? I just wonder where you're seeing that spike, if that information is available. Thank you so much.
Dr. Anjad, this is you, please.
Sure. Well, that kind of information, some of it we don't have on hand because we would have to link people to their vaccination history, whether or not they're having, infection rates. But if you're having, reinfections, we are tracking those. So people who have, gotten vaccinated, and if they get a reinfection, our epi teams are keeping track of those because we want to make sure we're not having variants in those types of cases. But also a lot of those cases are getting contact traced heavily because we want to know if you've gotten, of course, the vaccine and then getting reinfected. But a lot of the specifics that you're asking as well, would have to have a lot of data matching and cross references with epi teams. But we do want to know if you've gotten the vaccine, if it's a reinfection, and then all of those cases do get sequenced for the variants so that we know, because those are very important to track as well. Thank you.
Thank you, Mark. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if anyone could talk a little bit about the investigation into our previously unreported deaths. Governor, you said that information was delivered on Friday. Could you tell us a little bit about what we learned from that investigation? Where do we go from here? What steps are we going to put in place to, ensure this doesn't happen again? Thank you.
Okay, Charles. I've just gotten the report, and we'll be putting out a release about the report, and then we'll like I said before, we'll make the report completely transparent to everybody, and we'll be doing all that later this week. I want to say in the first viewing of the report, here's basically the way I see the whole thing. There has been way back, I think, when Dr. Slimp was here and everything, there was basically an installation of a second metric being used and everything, to where we had two reporting systems and they were moving along together, and basically what that allowed for is just like anything, when you get too many moving parts and everything, it's awful easy for for somebody to say, well, I thought it was here and it was over there, and it wasn't at all. But the net of the whole thing is it seemed to all be moving along halfway decent until we started really ramping up the number of deaths, and that happened in November, like I reported earlier. But I always believe the devil's in the details. And as everyone views this, the net of the whole thing from my side is just one thing and one thing alone, and that is this: we don't need two systems that are reporting. And I hate to say it this way, but if two systems are pumping out stuff that's not good stuff, not quality stuff, meaning two systems are pumping out some level of slow or distorted or whatever it may be stuff under reporting, even though I am convinced now that things, there's no guilty party from the standpoint that I can see. Now, I'm still looking. I want to reserve that right and everything. But here's the thing that I think we have to do. And I think this has shown a light on this too and everything. We have to now get on a pathway of one system. Charles, the good thing about this whole thing will be just this. The bad we know is, from my standpoint, is respect. When we let people that I'm reading their sex and their location and their age every day, when we let people not get reported for some period of time, it's disrespectful to me, and it's just not acceptable, period. Now, but the fallout of this is just this: forever in West Virginia, we've had people that have passed away, and families have really, really struggled to get timely death certificates and everything from the standpoint of collections on life insurance or being able to pay funeral expenses or whatever it may be. And people just drug around, and we're going to fix that. Now, I'm not sure exactly how, but whether we're going to have to drop back to one system, which I think that's what we're going to do, but we're going to fix that. And we're going to absolutely not be in a situation to where we have to disrespect people, by not announcing them timely and everything. But we're going to fix both ends of this. And from the standpoint of 100,000 feet, that's what I think we found. You'll get the report, and you'll get our press releases on that very, very, very soon.
All right, thank you, Charles. Next to June Leffler with West Virginia Public Broadcasting.
Hello, Governor and panel. Thank you for taking my question. So every day we hear that West Virginia is one of the best states in the nation as far as getting the vaccine out to people. We know almost 500,000 people have gotten a first dose. Now everyone 16 and above is eligible. And, you know, you guys are also making a really good push for this vaccine equity when it comes to getting it to Black folks and just people in more remote settings. So, you know, if West Virginia, you know, can do all of this and claim all of this, I'm wondering how is it that we have yet to vaccinate a single inmate in our state jails and prisons? And when are we going to start vaccinating those people?
Okay, let me take this, guys, and first of all, you know, I would tell you just this: West Virginia is not one of the best states. West Virginia has just been thought of as one of the poorest or most backward states, but we are not one of the best states. We're the best state, and that's all there is to it. The absolute best state. And you know, and I don't mean this in a bad way, but we better all damn well realize that, because along the way, West Virginia in this situation right here could have absolutely imploded. West Virginia could have melted down. Everybody, every single person out there probably would have said, well, West Virginia is going to implode, or they are going to melt down. And they didn't realize this incredible team that I've had around me, or how great the West Virginia people really are. So with all that, nobody could be more proud than that. To answer your question, here's the straight skinny of your whole question. Your question is, why have we not been vaccinating inmates up to now? And we've been chasing people 65, 80 years of age and older, and we've been doing that and trying to save lives in every way we could possibly save right there. Our corrections people have been so on top of everything from the corrections side, it is off the chart good. I think we've lost 4 or 5, and I don't know if those are inmates or staff, in all of our facilities. So really, when it really boils right down to it, when you got 2,638 people that we've lost all over the state in all kinds of different areas and everything, we ran to the fire where we should have run to the fire. From the standpoint of our corrections facilities, they surely have been one of the safest, if not the safest place in the whole state. Now, the last thing I'd say is just this. As we continue to run to the fire, those people deserve vaccinations just like we all do. And we are absolutely going to come there and come there very, very quickly now. There's plans already in the works, and absolutely you'll see us vaccinating our inmates and our staff there, and you'll see us doing that in a ramped up way in the very, very, very days or weeks ahead. And so we're on top of that, but I am telling you, there's no backing up on my side. Absolutely, I truly believe we're the best state, and I truly believe we've made the right decisions in trying to save the people that we saved. And from the corrections side, our corrections people have done one whale of a job, because that is probably one of the safest places where we can be right now. And that's something that hats off should be to our corrections people.
All right, thank you, June. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Governor, I think one of the reasons that you have got the top ranking is that you were prepared to act whenever vaccine became available. And I want to go with that question a little further. AstraZeneca coming online. I know we had been working on a week-to-week allocation situation. Do we have anything more long-term than that? And perhaps this is a General Jim Hoyer question. Long-term, to tell us how much vaccine is going to get here, how quickly?
General, you've got to answer that one. That's kind of above my pay grade.
Yes, sir, Governor. So, Paul, we don't have exact numbers, but what we do know based on our trend analysis is, unlike in the beginning of the pandemic when we were concerned from week to week whether we would get the same amount of doses the following week, we know that as we go forward each week, we are getting more and more doses. A good example is what the governor announced with Walmart. We know that we believe we're going to get roughly 2 trays of Pfizer doses at the 40 spread around the Walmarts in the state. I believe there are 44 of those. We know they're going to get a certain amount of Johnson & Johnson doses, but those numbers have not been finalized yet. So what we continue to do in the interagency task force with Joe Peel and the team there in the task force is to prepare for being able to put maximum amount of doses out that are received, and how we work with the federal pharmacy partners to make sure we get coordination across those entities. So the good news, Paul, is while we don't know exact number of doses, we know the doses continue to increase each week.
All right, thank you, Paul. Next, we'll go to Kelsey Soto with WSAZ.
Happy Monday, Kelsey Soto with WSAZ. This question is probably for Dr. Marsh or maybe Dr. Amjad. We've been hearing about a case of a serious reaction to the vaccine in Cabell County. I don't know if you can talk about, if we have seen any situations in the state of, serious side effects to getting the vaccine, and or overall, I guess the picture, I don't know if there's stats out yet or that sort of thing.
Okay, Kelsey, maybe Dr. Marsh, you haven't talked for a second. Let's hear from you.
That's unusual, Governor, so I'll be happy to take this one. So, Kelsey, thank you. We know that the number of truly allergic reactions to these vaccines is very, very small. Oftentimes, people have a reaction to, if they do have an allergic reaction like that, to a component of the messenger RNA vaccines called PEG, or polyethylene glycol, which is used as a solvent to make everything go into solution better. Some people have reactions that are reactions at the skin level, which is a local reaction, which is likely to be more related to a vigorous immune response against the vaccine than anything else. There have been some reports in Europe related to the AstraZeneca vaccine. Very rarely, there may be a blood clotting issue that is resolved with treatment of blood thinners, but that's very, very rare. So any allergic reaction or truly drug or vaccine related reaction is very, very low. A lot of people do feel kind of like flu-like for a day or so after they get the vaccine, particularly the second dose. And that is just your immune system vigorously responding to the vaccine. You can't get COVID from the vaccine. None of these vaccines have that information. They're all just giving you instructions for the spike protein. And the spike protein is what binds in our bodies to infect us. And therefore, all the vaccines basically instruct the body to create coding mechanisms. So you're coding those parts of the virus with immune sort of products that prevent the virus from getting into your body. So I would say that at a real reaction to the vaccine, very, very low, less than probably 0.1%. Certainly people can have some local reactions. That may be less than 0.5%. And then, for people, particularly after the second vaccine dose for the messenger RNA vaccine, some people can have a more kind of feeling bad arm pain, and that's probably a bit more common.
All right, thank you, Kelsey. Governor, I'll turn it back to you to close out.
Well, thanks again for all the questions, and thanks especially to my team, of experts. They're second to none. I can never thank them enough. They've been phenomenal. That's just all there is to it. I want to go back to one thing, just 1 second, because I feel like that as we come out of this, my responsibilities have always been, first and foremost, the health and safety of all West Virginians. But at the same time, I've told you over and over that the economics of all West Virginians are also an absolute giant priority in my life. That's what I think I'm here for. I'm here to look after the health and safety of everyone as best I can, but also look after the store and mind the store and look after the economics. From that standpoint, I want you to just, again, take 1 minute and listen to me very closely on this. You know, there's articles written all over the place. You know, I would really, in regard to the personal income tax, I would really, really appreciate if you could go online to Fox Business and look at the article that's written by Fox Business. I would also like you to pull up Newsweek and look at the article that's written that is an op-ed, you know, and you can pull up Newsweek and then my name. I'd like you to pull up, you know, the Wall Street Journal and look at the article that's in the Wall Street Journal. And lastly, I'd like you to pull up Sean Hannity and read what Sean Hannity is saying about West Virginia and about this plan. Now, more than anything, I want you to know just this. I would not come to you and tell you absolutely without any question that what you have got to do is give me just a few moments to where you are completely knowledgeable about what's at stake here. If you'll do that and we decide to go whatever way we decide to go, I'm with you 1,000%. But I know when you look, you will absolutely be enlightened if you will just take the time to do it. Now, just imagine just this. If I were to say to you, if I were to say to any of you, this holds us back so often, it's unbelievable. But if I were to say to you, in order for me to get you an extra $3,000 or whatever it may be that's in your pocket, you know, whether it be 300 or it be 3,000 of dollars, of extra dollars in your pocket, for what I would have to do to be able to achieve that and keep the state in balance, and let me be ridiculous just to make my point. What if I were to say, I'm going to have to raise the bubblegum tax a penny in order to be able to get you that kind of compensation, that kind of money? And your representatives would turn and say, by God, I ain't going to vote for nothing with the tax increase. You know, that's not good, and it's not wise. You have got to speak up, because absolutely, at the end of the day, if we miss this, it will be absolutely tragic to what could very well happen. If you want to see your towns and your communities and your schools grow, if you want to see roads being paved, we know how to lose. We know how to lose population. We have done it since 1950. The only state in the country that has lost population, the only one. We got losing down pat. It's time to win. It's time to move forward and win. I wouldn't do it on the back of anybody. No way on this planet would I do it if I felt in my heart that it was going to cost our needy extra dollars. No way, no way. If it was absolutely going to lay on the back of our middle income or higher income or our lower incomes, there's no way. We have made it to where everybody has more dollars. You've got to go and get absolutely knowledgeable about this. And then your voice has to be heard. Because if it's not, we're going to miss the biggest opportunity that we've ever had. You got to trust me on one thing. Go get the knowledge. Spend a few minutes and get the knowledge. Look at your grandkids or your kids and just think, if you don't get the knowledge, how much you could be absolutely letting them down. You've got to go get the knowledge. Once you get the knowledge, if you don't believe this is the way we ought to go, then I have no problem with that. And I absolutely have no problem. But I truly believe that we're in the dark right now and we don't understand it. And absolutely, if we don't understand something, we could miss the opportunity of a lifetime. I hate to just go on with that, but we're on a short fuse now here, and we've got to get across the finish line. It means everything to us right now. People will come, schools will flourish, roads will be built, our small businesses, my goodness gracious, our small businesses would be doing so much business, we can't stand it. And absolutely, every one of you will have more money in your pocket. You've got to go and look at this stuff and become really educated. Anyway, I thank you so much. I love you with all my heart. We're getting there on the COVID stuff, and we're going to stay on top of it. And thanks again to all the experts and all the guard and all the people that have, the local health people and all the people that have made great stuff happen. And the only last thing I'd ask you is, as more and more you become educated, call us. We'll get your materials. We'll answer your questions. Dial in really, really closely and watch. We'll announce it later today when my next town hall will be. And please, as you become more and more educated, call your legislators. They've got to hear your voice. They've got to know the people are going to step up. They will know it, but it could come too late. And then your voice is going to be disgruntled. It's not going to be a voice of seeking education. When you realize what we've missed, Katie, bar the door, because it'll be bad stuff. Anyway, thank you so much.